didn't die from cancer, they didn't
Yeah.
die from chemotherapy, they died from pneumonia.
So it's usually infection. I've had this one patient, renal cancer patient, an elderly renal cancer patient, stage 4, who was in and out of the hospital. The reason why he passed was because of an infection he got from the hospital.
Wow. And
So-
like sepsis also is
Yes,
another.
he
so
ended
if-
up in sepsis.
Okay.
Then he eventually passed. So, really, vaccination against these common illnesses, common infectious diseases, is really very important.
Hi, welcome to another episode of Simply Healed. And today we have a very interesting topic for cancer patients, which is vaccination for cancer patients. So, welcome again, Dr. Jansen.
Hello, Sean. Hello, everyone. Happy to be here again.
Yeah, the last 2 years we were in a pandemic, so vaccination became an important
Yes.
topic. And there were actually questions because should cancer patients get COVID vaccines? But another very interesting question, if you're going for chemotherapy, you know that your immune system is going to be whacked.
Yes.
Is it a real strategy? Is it something cancer patients should think about, that while their immune system is strong before the chemotherapy, that they go and vaccinate from things like influenza or COVID, and then so that when they go for chemotherapy, they already have one layer of protection, so that when their immune system is weakened during chemotherapy, they are protected from these diseases?
Yes, because if you undergo chemotherapy, of course your immune system will go down. And the number one concern of oncos, actually all doctors, is infection.
Oh,
Because your body won't be able to fight infection because your immune system got whacked.
that's why for chemotherapy, red blood cell count and white blood cell count is always monitored by your
yes,
oncos.
yes. Okay, so actually, to be honest, this vaccination among cancer patients is usually a topic that is not much discussed, even among healthcare professionals.
So this is not something every cancer patient thinks about.
Yes, it seems that it's not a priority, or you are so focused on the cancer and you tend to forget about these things, which are also as important, because preventing infection is the number one thing that you should do.
To our audience right now, why this is an interesting topic and worth talking about, I actually know of a few cancer patients that died from pneumonia. They went in for chemotherapy and they caught a cold. It developed into pneumonia, and they didn't die from cancer. They didn't die from chemotherapy. They died from pneumonia.
So it's usually infection. I've had this one patient, renal cancer patient, an elderly renal cancer patient, stage 4, who was in and out of the hospital. The reason why he passed was because of an infection he got from the hospital.
Wow.
So-
and like sepsis also is
Yes,
another.
he
so
ended
if-
up in sepsis.
Okay.
Then he eventually passed. So, really, vaccination against these common illnesses, common infectious diseases, is really very important. Okay?
So we will go into this topic, some quick guidelines, and you can ask during the Ask Me Anything which of the vaccines that we were talking about interest you and you want to talk more about it. All right. So
Okay.
yeah, Doc, what are the simple vaccinations that a cancer patient should consider before, like for example, going for chemo?
Okay, so first let's discuss the timing. Now, when would be best for you to take to receive a vaccine? Okay, it should be prior to any treatment that you would be receiving. Prior to initiation of chemotherapy, before you receive radiation therapy, before you have your spleen removed or
Why
undergo
is the
surgery.
spleen? What's the function of the spleen?
The spleen is sort of like the graveyard of the blood cells.
All right.
Now, usually, why do we undergo splenectomy is because, for example, for blood malignancies like leukemia, it's usually the spleen usually enlarges. You have to remove the spleen so that it doesn't affect the other organs, because it can grow so large. It can obstruct your digestive system and cause a lot of discomfort on the patient. That's why we have to remove it. And usually, if we remove the spleen, together with that is we are more prone to a lot of infections as well. So another one is if you're going to be receiving any immunosuppressant medication like steroids. So this is not only true for cancer patients. This is also true for those who have autoimmune diseases or anyone who's going to receive a long-term steroid therapy. Now, we have two kinds of vaccines. We have the inactivated vaccines and the live vaccines. Now, when can you, or how soon can you get vaccinated? Okay. it should be at least 2 weeks prior to receive or prior to the initiation of the treatments that I have just mentioned. Okay? So that would be for your inactivated vaccines. If it is a live vaccine, then it should be at least 4 weeks prior to the initiation of the treatments.
So sometimes that makes vaccination of live vaccines not possible because in urgent cases they have to go for chemo really soon.
really soon. Okay,
Alright,
so what if you are already someone who's receiving chemotherapy, or it's really too late already in the timing? So we have to then wait after you complete your chemotherapy. So how soon? So after you completed your chemotherapy, it's at least 3 months before you can receive vaccines again.
Okay. So, Doc, just to refresh everybody's memory on vaccination, you can't actually catch the vaccine. You can't actually catch the disease from the vaccines, can you?
You cannot for inactivated vaccines.
All right. So, just in case someone is thinking that you have recovered, you just finish your chemo and then you go for a pneumonia shot, and because of that you get pneumonia.
Yeah.
That won't happen.
That won't happen, except for live viruses.
Okay, so don't take the live vaccines. That would be your measles, rubella, herpes. But influenza, pneumonia, all this, hepatitis B, A, HPV, all these are actually inactivated. So they're very safe for you to take, even when your immune system is weak after chemotherapy.
Correct. Okay, so now let's go through each of the vaccines. Okay, so let's focus on the inactivated vaccines first. So here they are. So there are so many, and I will only focus on 4. Okay,
all right.
Because
the key
of time.
ones.
Okay, the key ones. So number 1, very important, is COVID-19. You have to receive a full dose of a COVID-19 vaccine together with boosters. Okay, 2 vaccines
and
to be fully vaccinated.
Very interesting because in Singapore on CNN, I sent you that particular article also. They actually said that the inactivated vaccination for COVID-19, which is your Sinovac,
yes,
creates a broader reaction that allows your immune system to tackle variations of COVID-19 better than the mRNA. Okay, we're not saying that the inactivated vaccine is better than mRNA, but it has a different result. So the ideal is to have both.
The ideal is to have both because you'd have a wider range of weapons. Okay. So anyway, moving on. No? Let's go to influenza. So influenza vaccine is really quite well known. Okay, it's a dose that all companies give away to their employees anyway. So for influenza, 1 dose annually is still the standard, even if you are receiving chemotherapy already. So there's no reason even if you are receiving chemotherapy, there's no reason for you not to get it. Okay.
So is it advisable, like during flu season, for a cancer patient to actually make sure they're vaccinated if they're going to go for chemotherapy?
Yes, even if you are already receiving chemotherapy, okay, it's okay for you to get a flu vaccine, right? So this is the exception among all the inactivated vaccines. So it's the only one that you can receive, even if you're undergoing chemotherapy already. Now let's go to pneumococcal. So,
this is pneumonia?
Yes, this is for pneumococcal vaccine.
Does this mean that if you take this vaccination, you are vaccinated against pneumonia, or it's just that your chances of getting pneumonia is much lower?
You would be able to prevent yourself from getting pneumonia.
Wow.
So yes, this is really very
good
important
because a lot of cancer patients actually die because of edema, which is water in the lungs, and then it develops into pneumonia.
So, but here's the thing, no? Because the pneumococcal vaccine is only specific strain of bacteria. Now, you would be able to prevent getting infected from that specific bacteria.
But you can still develop pneumonia from other
the other variants. Now, here's the problem. The one that the pneumococcal vaccine has is the most common cause of pneumonia among cancer patients and for all people for that matter. Now, the exception are the atypical organisms or the atypical microorganisms. So that would be the rarer ones or the more uncommon ones. Okay?
But I think this is still the best bet.
This is still the best bet because immediately you take away the most common reason for you to for you to get pneumonia.
Yeah, I can't
Right?
stress this enough because truly a lot. I mean, we actually have quite a few cancer patients who died because of pneumonia.
Okay, so how should you be receiving the pneumococcal vaccine? So for the pneumococcal vaccine, you have two. You have the PCV13 and PPSV23. So what's the difference between those two? It's just that PCV13 makes you immune to 13 variants or 13 species of the bacteria, of the pneumococcal bacteria. For the PPSV23, it's 23 strains.
All right.
Okay, so for PPSV23, it's more complete.
All right.
Okay. Now there are two ways on how you can go about this. First is for you to receive PCV13 first or Prevnar. Then after 8 weeks, receive the PPSV23. Then that's it. Okay. Or the other way around is for you to receive PPSV23 first, wait a year, then receive another dose of PPSV23.
So if
Then that's
you okay, and then this can be taken just 2 or 3 weeks before chemotherapy starts.
Yes, it should be at least 2 weeks before chemotherapy starts. So you'd have an option here. So it's very important for you to have a date already when you would undergo chemotherapy. Then undergo these vaccinations. Now, if it's really too soon, right? Let's say, for example, you're about to receive your chemotherapy a month from now, then it's impossible for you to receive the second dose if you follow the first path, right? So what you can do is receive PPSV23 first, then wait a year. So the following year, when you're done with your chemotherapy, then you can receive the second PPSV23. But if you still have much time, then it's better for you to get fully vaccinated immediately. So go for PCV13 first, then after 8 weeks, go for PPSV23. Okay. So next would be your HPV virus. This one we have a whole video about this.
Just go and look at the. This is for cervical.
This one is for cervical cancer. Now, for the human papillomavirus or HPV vaccine, no, all men and women should receive this. Okay?
All right.
Men
it's not
and
just
women.
only for women.
Yes, it's not just for women only. Okay. So why? Go watch the video. Okay. So it is recommended for everyone who are between 9 to 45 years of age. Now, the schedule of the HPV vaccine would depend on which type of HPV vaccine you will receive. So, if you want, just go and ask during the Ask Me Anything segment.
Yes.
Okay, to know more details. Now, next, let's go to the live vaccines. For the live vaccines, I'm going to focus on varicella and herpes zoster because
I was wondering what varicella is. That's chicken pox.
Yes,
all
that's
right.
chickenpox.
Okay, that's chicken pox.
Yeah, so I'll focus on varicella and herpes zoster because MMR, everyone should have received that when you were a kid.
Okay.
But if you want a booster, it's okay. Right? Now, for live vaccines, remember, you should receive this at least 4 weeks prior to the start of you should complete your dosing prior to the initiation of chemotherapy, at least 4 weeks. Okay? So for varicella, this should be given to those without immunity to varicella or chickenpox prior to the start of chemotherapy. So if you have had a history of chickenpox already before,
then you don't
need it anymore. Now for herpes zoster, 2 doses is preferred. Herpes zoster is more of to prevent shingles.
All right.
Okay, because shingles can be so painful. Shingles would be a blister on a specific or an area in your body. It can be very painful. It can blister, so it can heal badly as well. So it will leave a scar on your body. And of course, for women are more concerned.
It's important to look good.
Yes,
right?
it's important to look good. So this might be something to consider. Okay. Yeah.
All right. So I think, Doc, this is a very unusual topic, something that a cancer patient seldom thinks about. But again, we brought it up so at least you can ask your uncle about this. And in our experience, in my personal experience, having lost patients because of pneumonia, cancer patients due to pneumonia, I wish we knew about this. So among all these vaccines, I personally am interested to ask patients to think about the pneumonia vaccination before they go for their chemotherapy. So, Doc, any last words before we go into our AMA?
Okay, so if for those of you who are living in the Philippines, especially in the Metro Manila area or the nearby provinces, if you are really interested to get yourself vaccinated, please don't hesitate to message us so we can schedule an appointment so I can get you vaccinated. Okay, so that would be it. We're already seeing so many questions in the comment section.
And
so,
a lot of them are not about vaccines.
Yes.
All right.
so yeah, let's get it on.